So I have widespread arthritis. My mother had it, runs in the family. My big issue was the real loss of range of motion. I could no longer do water aerobics. I couldn't swim. I was starting to have trouble getting dressed. I could only reach things in the cabinet. Like I couldn't take a plate down with that hand. I couldn't do it anymore. Based on referral from the surgeons I had had before, I went to see this shoulder doc, and he said to me, "You need bilateral shoulder replacements." And my whole body said, "Oh, no, you're not." I knew I could not go back there. I have not ever been as unwell and undermined in a rehab as I was around my knee. The surgery was very successful and the rehab was very linear, but the rest of my body was screaming. And I went back to my group of colleagues who all think bigger than Western medicine. And I said, "What do I do?" And one of them went home and talked to her son-in-law, who's a chiropractor, and he said to me, "Find a functional medicine doctor." When I got the diagnosis of the shoulders needing replacement, I had barely gotten back on my feet. I had regained the weight I lost. My energy level was back up, all thanks to the functional doctor. It was terrifying. The thought of losing that kind of functionality was just it's not acceptable, but the thought of having to do it surgically was also not acceptable. So she said to me, "Have you ever heard of PRP and stem cell transplants?" And I thought to myself, you have absolutely nothing to lose and everything to gain, so go investigate this. When Dr. Patel explained to me what the procedure was, why it worked, it made sense to me as a biologist. And so we did the x-rays and we did the MRIs, and then we came back here and we talked some more about what she saw. And I was shocked at what she saw. I figured I had nothing to lose except the cash and that I was worth the investment. And I knew, and my husband also knew, that we didn't want to go back to the OR. She drew some blood, she spins it down, she pulls off what she needs, and it's no different than a cortisone injection. So it was one injection in each shoulder. One I did not feel, and the other one felt like a minor bee sting. You know, the bee who just about gets you but doesn't really get you. And that was it. I'm in the pool. I could swim again. I'm pain-free. And so for me, it was the best thing I did for my body. I have recommended to a whole flock of colleagues and a couple of personal friends. The personal friends sit back on the seat and they look at you and go, "I think I'll wait till my knee is worse." And I go, "Well, why would you want to do that when there's more to heal? Like there was less to heal in this shoulder than this shoulder. This shoulder took a year. This shoulder took 3 months. Why would you wait?" Regenerative medicine has offered me an opportunity to witness the miraculous healing power of the body, to allow my body to be healed or cured or restored. This has made not having my life encroached on by this disease so easy, so much more comfortable.
The Supreme Center of Excellence in Pain and Regenerative Medicine